Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Wednesday, August 5th, and this is my daily briefing. We've had 291 cumulative positive cases of COVID-19 in Missoula County to date. That's up 8 since yesterday. 287 were identified by testing and 4 were epi-linked. We've had 208 recoveries and 1 death. 3 Missoula County residents and 1 non-county resident are hospitalized in Missoula County. We have 82 active COVID-19 cases with more than 330 close contacts at this time. Active cases and their known contacts are in quarantine and isolation, and they'll continue to be monitored and supported as needed. The state of Montana is reporting 4,429 cumulative COVID cases, which is up 115 cases since yesterday. There are now 1,544 active cases across the state with 79 active hospitalizations, and there have been 65 deaths related to COVID-19 in the state of Montana. Today I'm going to share some really important information related to a recent salmonella cases linked to onions across the country and at home here in Montana before I talk about some COVID updates. So Montana state and local public health agencies are investigating 52 reports of confirmed and suspected Salmonella Newport illness linked to onions from Thomas International Incorporated. Illnesses began as far back as the end of June, with illness reported throughout July and into early August. And on August 1st, Thomas International voluntarily recalled red, yellow, white, and sweet yellow onions because they may be contaminated with salmonella. The CDC is reporting nearly 400 salmonella cases in 34 states with 59 associated hospitalizations. Here in Montana, we've seen 52 cases confirmed and suspected across 16 of our 56 counties. And those cases do include at least 4 confirmed cases in Missoula County. This particular salmonella outbreak is linked to onions from Thomas International Incorporated, which is known under multiple different brands. The CDC, FDA, Montana state and local officials advise consumers, retailers, and restaurants to not eat, sell, or serve the onions from Thomas International or any of their related subsidiaries. This investigation is ongoing, and more brands may be added to the list of salmonella sources as we learn more information. The state DPHHS, the state health department here in Montana, will be putting together and sharing a press release later today that will provide more details about this salmonella outbreak, including names of subsidiary companies, general advice to consumers, restaurants, retailers, and suppliers. Salmonella symptoms can really vary with each individual, but in general, they often include a sudden onset of diarrhea, fever, nausea, vomiting, and abdominal pain. Some people may experience dehydration as a result of those other symptoms. Most people with salmonella start feeling sick about 6 hours to 6 days after eating or drinking something containing the bacteria. People with salmonella typically recover without treatment in 4 to 7 days. So in the coming days, please revisit what you've got stocked in your home refrigerators and pantries. Check onions for distribution and product labels, throwing away any onions that might fall under that Thomas International name, as well as any onions that you can't really discern where they came from. This kitchen sweep includes old foods that may have been laying around, like leftover home-cooked meals or takeout. Toss those foods if they contain onion, especially if you're not sure where the onion came from. If you're going out to eat or ordering carryout and onions are in the dish you're interested in, just ask the establishment about their distributor, or just keep it easy and not order dishes that have onions in it for the time being. If you have additional questions on this particular outbreak or about salmonella in general, please refer to the health department or DPHHS's website or the CDC for more information about this outbreak. As far as COVID updates go for today, I'd just like to let you know that we continue seeing people experiencing COVID-compatible symptoms at our county testing clinic on Flynn Lane. If you are someone experiencing COVID-like symptoms and you need transportation for disability services, or if you're caring for someone experiencing COVID symptoms that needs transportation for disability services, please connect with Mountain Line to identify safe transportation options to and from our testing clinic. If you have an appointment with us and you are in need of transportation for a disability service, please connect with Mountain Line at least 2 hours in advance of your appointment, and they should be able to coordinate a safe ride for you via their public transportation service. So that's it for today for my daily briefing. As always, you can subscribe to me on YouTube under my name, Cindy Farr, that's CindyFarr. Click that notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can check out our website at missoula.co/cvirus for the most current information. You can also call 258-INFO if you're experiencing symptoms of COVID-19 and would like to get a test scheduled, or if you just have general questions about COVID-19. So until tomorrow, everybody stay healthy.